Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Alright Dan, tell me what's going on with your thumb.
My joint in the corner of my thumb and my index finger. Feels like it has a nodule on it, and my thumb doesn't flex anymore, and it's starting to affect my index finger.
How long this been going on?
Approximately 1.5 to 2 years.
2 years? Okay, how did you do that?
Overuse, I think.
Okay, so repetitive strain injury?
Yeah.
So a lot of typing and stuff like that using the phone? Okay. How much pain do you feel there from 0 to 10? 10 is emergency room.
At the moment? 1.
Okay. When you move it, like when you do like some work, how much at worst?
Let's say if I overuse it for the day, maybe typically 4 or 5.
4 or 5?
It's enough that I'll sit there and rub it.
Okay.
You know, and try to massage it.
Okay. Can you do the motion that aggravated now?
I mean, it's kind of everyday stuff, right? So typing, I think partly is like the phone, you know, one-handed, probably this motion. My mouse use, so moving the mouse from. So there's other everyday things that you don't think
So this been going on for 2 years. What kind of treatments you had before coming here?
I had some acupuncture, which would help it for periods of time, but I
doesn't
had to
last
so often that it wasn't covered, so it's not financially feasible to go long enough. Massage, that's about it. Nothing. I self-massage it quite a bit.
Okay.
I've tried myself icing it at times.
Ice is temporary.
It didn't.
So ice and acupuncture and massage, based on the studies, is temporary pain relief, based on the studies. Okay. So, and you said you feel like nodules there. I want to see your range of motion, compare left and right, because before I was able to see like you can bend, like bring this back more. The other side did not.
So you want to see that?
You want to see the difference between left and right, so hold both of them. Okay, so that's, yeah, that's tight. What else? What else? Let's do fist. Okay, can you go?
That way it doesn't.
Can you do this? Any pain with that?
No.
Okay, all right. So, if
when it's at its worst, and that, I mean, when it's at its worst, you can really feel like you could just touch it and it's tender.
If I give you something to squeeze, you gonna feel it?
Probably maybe a little bit, but not a lot. I mean, he just shot it up last Thursday. So.
Okay. So you had like a cortisone shot?
Yeah.
Okay. Can you get like a 2 pounds? Okay, we'll get you the weight. Yeah. And I want you just to move it around and tell me how this feels.
Just move it around this way, or just like
squeeze it.
See, it doesn't really get into that joint that much. If I put my hand on top of it, if I put it on there hard enough, I can irritate it.
0 to 10?
It's low. It's probably about a 2.
Okay.
I mean, I'm trying to irritate it, right?
Okay.
I know that push-up position can, when it's bad, it hurts. You know, that weight on top of that.
Okay.
Hand.
So I'm gonna do 1 hand push-up here.
Okay.
Okay. Just to not your whole body, just to get the feel of it, and push on it, and tell me how that feels.
It's not so bad right now. But I know at times it can be.
Okay.
What was it? We're doing. I think it was burpees going down to the ground, like full body weight. You can't do it on this thing.
Oh, okay. Because of the pain. Okay. So you can have a seat here, and I will start working on it. Make sure everything pain-free. Okay. So you said you have a scar tissue here. Okay. See the range of motion. See the difference? This is going back like this. And this
Yeah.
is not. Is that painful?
Yeah, once you hit
How
right,
much
right
from
there.
0 to 10?
I mean, it's like say 4.
What about when I touch you there?
I mean, I
I
feel
feel
it.
the scar tissue here.
Yeah,
That's
it's
the
like-
scar tissue. Yeah.
So it's like 3 to 4.
Okay, around
If-
here. Yeah.
Yeah.
And
When it's bad though, it's worse.
So, can you tell me what's happened here? Like in the morning, because of this, what's going on in the morning?
I don't know. Some mornings I just wake up and my hand is in
Mm-hmm.
kind of this position,
Oh, cramping like
cramping.
that?
Um,
Is that on a daily basis or just once in a while?
I wouldn't maybe call it as often as daily, but I would think
Mhm.
it's more than once a week.
Mm-hmm. So we have this scar tissue here. So doing this is tight. Yeah. So with me, if you feel any pain like that, you're gonna work on breaking the scar tissue now that you feel it there, and we'll check your range of motion after that and see how you're doing. Okay. Is that painful here?
Not too bad.
Make sure it's not painful. You hear that grinding there? That's a scar tissue there. Why scar tissue could be an issue? Because our muscle should act like a rubber band. When it contracts and relaxes, it does this. When you have a scar tissue, it's like you have a knot in the rubber band, so the muscle does not contract much
Okay.
and just limited the range of motion. And it's very typical, like when you have like repetitive strain injury. Every time we have a slight micro tear in the muscle, and that's causes scar tissue. Too much here? Okay. Make sure this is not painful. This is a knot you're talking about. That was like really big.
Yeah, it's a little more painful, but
Sorry,
it's
sorry,
not.
sorry.
No, it's not unbearable. It's not.
Yeah, because if you feel pain, that might cause more scar tissue, so we don't want to cause that. So you have acupuncture and massage here. You feel that here? It's a scar tissue too.
I would guess there's a lot of scar tissue. At least.
Yeah. I'm not surprised with like typing a lot and a lot of working on the phone. You know, it's very typical to have that scar tissue. Yeah. Feel that here? Then this muscle attach here, going to your arm, your fingers. So if you have a lot of scar tissue, it's just limited the range of motion. And usually you will feel the pain where you compensate for that limitation. You know. And you can see the redness here where the scar tissue actually. See that? You feel it here. You see that line of scar tissue? Yeah. Can you see that? Can you feel
Yeah.
that?
No.
Say yes. The
Yeah,
correct
sure.
answer is yes. Okay. And it's cramping a little bit here. Let me know if it's too much, okay? And here you feel that scar tissue here, that bump.
Yeah, it's a little sore.
Sorry. Well, you're really doing a lot of work with your that's now. Yeah. Okay, so move it around and tell me how this feels now. Can you tell the difference?
Yeah, a little bit.
Mm-hmm.
Yeah, it's like this, especially this section is a little bit more tipped.
Mm-hmm. Is it back to normal or is still full tightness?
No, I still feel some tightness. But,
Where do you feel it?
kind of like right in this transitionary area right
Okay.
here.
That's too much. That's a big scar for that here. It's crunchy. I don't know if you can hear that. It's really
I
crunchy.
can hear it.
Yeah, it's loud in here. You hear that? Yeah. Let's make sure it's not painful, okay?
Okay.
This is exactly. And we have it in here too. You're right-handed or left-handed?
Right-handed.
Right-handed. You can see all the redness around the scar tissue too. Okay, try it again. 0 to 10.
It's a little bit more flexible. It still feels like, I don't know if it's just because you've been working on it. It's a little like not sore is the right
It's a
word.
more frame. Okay, you feel the soreness where you can see the redness where you have the scar tissue.
I think it's just because you worked on it.
Yeah, make sure it's not painful while we're doing it, okay? Because I don't want to cause a scar tissue. I want to make it all, okay? You're gonna get a couple of things here. See how you're doing with that. Take care. Is that painful? No, it's okay.
It's okay.
Oh, sorry. Feel the tightness there?
Yeah. A little bit.
Sorry. Yeah, you see it in here?
It's not painful, but it feels like you're stretching it.
Make sure it's not painful. Okay, try it now. And we'll get you some more. Make sure you drink enough water after the treatment, because when we break the scar tissue, that's released toxin in this product, so I want to make sure to flush it out so you don't feel soreness from the treatment. Okay, so let's move it. How's that?
It's moving a lot better.
Yeah, you're moving a lot faster now.
Yeah. Just a little. And just like front joint here.
Tightness in there.
I think.
But this is fine now.
Yeah, I mean, it feels a lot better. I mean, it won't, it doesn't, it still hasn't got to that point, but it's a lot.
It used to have the same range of motion.
It used to do basically this, which
Yeah,
is kind of how I
there's a
know.
lot more scar tissue here, but as long as you start to have flexibility, that's a good sign. Excuse me. So you feel it right in here, yeah? Let me know if it's too much, okay? Too much?
That's about good right there. I
Okay.
feel it, but
Okay.
it doesn't. Yeah, I feel that actually even in here a little bit when you did that. sore there, but not.
Sorry.
No, that wasn't painful.
Okay, so move it around and tell me how that feels.
Yeah, it feels a lot better.
Mm-hmm. Any pain or just gone?
No pain. No.
Mm-hmm.
No pain. I mean, so when I move my thumb like that,
Mm-hmm. You feel
it's
stretching,
it's like a
pulling a little bit?
like a pulling almost.
Mm-hmm. Mm-hmm. It's from the lotion, it's like,
Yeah, that hurts.
sorry. Mm-hmm. Yeah. Okay, try it again. You still
Yeah,
feel it or it's
that's-
gone?
It's gone.
Mm-hmm. Alright, awesome. Yeah. So what do you think about ASTR treatment, what you just did in a few months?
It was good.
Yeah,
Yes,
yeah.
yeah.
Can you tell the difference?
I can definitely tell the difference
Yeah,
in the
it's look
flexibility
like
of it
looser,
and
yeah.
how quickly they can move it now.
Yeah, awesome. Thank you so much.
Yeah.
Thank you. Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.